Hello everyone and welcome to another episode of Talking Threads. I am Dr. Mehzabin Kharodawala, the General Dentist at Zulekha Medical Center, Al Khan. So today we have with us Dr. Ali Kaja. He's a specialist pediatrician at our Zulekha Medical Center, Al Khan.
Good morning.
Good morning, doctor.
Good morning. Good morning.
And welcome. So today's episode is going to be very interesting as we talk about the pediatric health from a dentist perspective and the pediatrician's perspective, doctor. So, doctor, can you just guide us on how the nutrition plays an important role in, child's health and well-being?
Yes, you know that teething started usually 5 months of age.
Yes.
For that, nutrition is very important, and we have to take care about nutrition before teething starts.
Yes.
Yes. You know that healthy nutrition is important. A lot of minerals, vitamins involved in the teething growth. Yes. For that, healthy food is important.
Yeah, even when the parents ask me as a dentist, I suggest them, to include essential nutrients like calcium, vitamin D,
yes.
phosphorus,
yes.
because they help in building, the enamel, and they take care in the formation of proper development of the teeth.
Yeah.
If there is any problem in these nutrients, it can really increase the risk of the cavity, form a defective enamel.
Sure, because if the nutrition is not well, that means the calcium, vitamins, magnesium, it will be low. And also the protection layer of the teeth, it will be weak. For that, yes. The other food, it can affect bad.
Yeah. So we suggest the parents to, have a balanced approach when it comes to, a diet.
Dr. Mehzabin, I have a question. At what age should parents take their child for the first dental care, dental visit?
That's a very important topic to discuss. The American Academy of Pediatric Dentistry advises us to schedule the first visit within the 6 months of the first tooth eruption or by the time the child turns 1, whichever is earlier.
Yeah.
Because usually the first visit is more about educating the parents and familiarizing the child with the dental environment. So if the first visit is scheduled by this time, it will help the child to make or build the healthy habits for lifetime.
I think also especially for infants who use the bottle also,
yes.
because it can affect
yes.
badly to the teeth. Okay, thank you, doctor. Thank you.
So, doctor, we would like to know how the nutrition, affects the overall growth and development in children.
Yes, development and growth is very important for kids. For that, we have to take care about nutrition. Nutrition have to be healthy, have to be also a lot of kind of food have to receive. And all minerals and vitamins is important. For that, healthy food is important.
Yeah, especially when it comes to dental, we advise the parents to focus on important nutrients like calcium, phosphorus, vitamin D, because they play an important role in the development of enamel.
Vitamin D is very important point because here everyone has a deficiency of vitamin D.
Exactly.
We have to take care about it. Sunshine, it's not available for everyone. For that, food and supplement is very important for vitamin D. Vitamin D is important to fix calcium and magnesium in the bone and teeth. Yeah.
So we suggest that the parents should always encourage the children to have a balanced diet, and they should include various fruits, vegetables and dairy products in the children's regular meals. So doctor, we would like to know how excessive sugar impact the overall health in children.
Yes, sugar and sweet food usually it can cause obesity.
Yes.
This is the main cause for obesity. And increase also the level of lipid. It can cause later many problems. But also, I think also from the side of dental care, also sugar can affect badly.
Sugar and things which are high in sugar are really harmful for the teeth because they tend to stick to the teeth longer time. Things like candies, toffees, milk, like sugary milk, constantly put the oral environment under acidic conditions, and it makes the teeth more susceptible to the decay.
Doctor, how important in brushing and flossing is in early children age?
Brushing is very important, very, very important. as you know, you must be knowing, when the newborn baby, we advise the parents to use a soft cloth to wipe the baby's gums, and after the eruption of the tooth, the parents can use a finger toothbrush or a soft brush to clean their teeth.
Yeah.
And when the child turns 3, the parents can introduce a fluoride toothpaste, but that should be pea-sized amount.
Yeah.
And flossing can be started after the children have the adjacent teeth, because in the adjacent, when the teeth are together, the brush will not go in between. So the flossing can help to clean the food lodgement between the 2 teeth.
Yeah. Yeah.
Brushing and flossing is more about building a habit, and I would suggest the parental supervision while the kids are brushing the teeth, because the child doesn't have the manual dexterity up to the age of 7. So the parental supervision is very, very important.
Okay. Yeah. What are early sign of dental problem in children?
Okay, so the early dental problems look like white spots on the teeth, brown or black discolorations, bad breath, bleeding gums, and in fact some of the kids they totally avoid eating because of the pain they feel while chewing. So that can also be taken as one of the signs which parents should consider that the child is having a problem in the gums or teeth.
Okay.
What are the common nutrition mistakes parents make?
Sweets and sugar food, it's very bad to the healthy because it can cause obesity and increase of the rate of fat. Skipping some meals also, especially for breakfast, is very important meal, but some kids skipping this meal. Drinking a little of water also. Well, water is very important for dehydration. It can cause.
Junk food.
Junk food is very bad also. It can cause obesity, and with the high calorie without any benefits. Yeah. Dr. Mehzabin, how do habits like thumb sucking or pacifiers affect the teeth alignment?
The habits like thumb sucking and pacifier, they can interfere with the alignment of the teeth and the development of the jaw. It can lead to problems like anterior open bite, proclination of the front teeth. So if these habits stay beyond the age of 3 to 4 years, then intervention is necessary.
Okay.
It can be in the form of counseling or habit breaking appliances.
Yeah.
How important are pediatric checkups, and when you think it should be scheduled, like how often they should be scheduled?
Yeah, routinely checkup for kids have to be or have to start from the birth.
Oh.
This is first visit have to be.
Okay.
Then usually first 6 months after birth, regularly every 2 months. This is a routinely checkup. After that, it will be every 3 months for the second 6 months. After 1 year of age, usually have to be once yearly. Every 6 months to 1 year have to do one checkup. Checkup that mean we have to check about height, about growth in general, height, weight. And head circumference also. We have to check BMI index. It's very important for obesity, and also sometimes we have to check by some lab tests because some like iron deficiency is very common, especially regarding to the nutrition. We have to check about iron deficiency and vitamin D. This is very important point.
What is your advice to the parents, to encourage healthy eating habits in kids?
Firstly, have to choose correct nutrition.
Balanced diet.
Yes, correct. Healthy nutrition, and avoid sugar and sweets. This is and junk food. This is very important. And also have to be at least 3 meals daily. Have to keep it 3 essential meals daily, with some snacks in between, but also have to be healthy.
Thank you so much, doctor, for your valuable insights. I'm sure this is going to help the parents build a very healthy lifestyle for the kids. Huge thanks to Dr. Ali. So that was all we had for today's episode of Talking Threads. See you in the next one.